Great. Hi, everyone. Brenda Hudson, director of our official name is the Recruitment Concierge Service. And I'm going to talk with you about All In for Health and All of Us. And I have Net Senate on here as well from Biostats. She's my partner in crime and All In for All of Us. And so she's going to be my person helping with any questions related to that. So we're going to go into both. I'm going to do 20 minutes on All In for Health and probably about 20 some. All of us will take maybe a little bit longer. But I like questions kind of coming through, so feel free to ask them as they come up, and we can kind of stop and answer them. All right, we're going to start with All In for Health. So what is All In for Health? It's an initiative of the Indiana CTSI, whose mission is to engage the public in the understanding and role and value of research. But really the main goal is to become the trusted partner of the community, to kind of get the public not just engaged, but actually, you'll hear a lot from us, bi-directional communication, so that they actually become partners and collaborators in the research. So it's not just a push out, that we're also like talking with them about what do they want to see, how can we make the research better to make it more applicable, what's going to make it more likely for them to participate. So those types of things. And All In for Health is, across the entire CTSI. Part of my space sits in the Office of Clinical Research, which is also across the whole CTSI. But I just want to make sure that regardless of what institution you're at, if you are part of the Indiana CTSI, we are here to kind of help you, and that's for both projects. I thought it would be helpful a little bit for All In for Health to kind of provide just a little bit of data for you. This is what the confidence that the public has in medical research. I don't know if people here will be surprised. I wasn't too surprised if you're listening to any of the conversations, but that trust in research has gone down since the pandemic. And so our goal is to kind of engage the public more to kind of build back up that trust. Now, they do have trust. Like if you ask them about IU or Purdue or University of Notre Dame, they have trust in that. Not surprisingly, if they have an affiliation or they had some engagement with one of those institutions, they're usually generally more trusting of that. So when we were out talking with folks, if you're a big IU fan, you might be more trusting of IU, or same with Purdue. So I think that there's a lot of connections that we can make. But as you can see, we have a lot of work to do to really improve confidence and trust in research. And so that's part of what All In for Health is aiming to do. So, basically we're trying to make the voice of research the priority. We want people to be able to find out about research studies. Where can they find them? Where can they hear more? Not just so that they can participate, but also part of this is to be transparent. As with the exception of University of Notre Dame, Purdue and IU are public institutions. And so we need to be transparent about the type of work we're doing so that the public can see that. And these are good ways to kind of do that. The ultimate goal is when we're partnering with researchers that we are providing information about those studies back out to the public in a very digestible way that's of interest to them. So, we're ultimately thinking about, we're going to write a paper and we're going to show what has happened with this, but really the public just wants to know, real quick, who, what, why, when, how, what happened, why should we care kind of thing. And so kind of helping tell that story. We have some communication experts that can help with that, but we really like to kind of send that information back, even if it's like, here's how many people participated in general, this is what it looks like is happening with that research. And then also it's to connect them to valuable health resources that are backed by scientific support, so that when they're looking at information on supplements or things like that, that they can kind of find and maybe be able to read through or know what's more of a trusted source versus what is really like an advertisement kind of thing. So what is contained within All In for Health? Like I said, it's a bi-directional communication that's primarily through social media. So we do a lot of Meta, so Facebook and Instagram, that we find that that's actually the biggest platform, believe it or not, that people are utilizing. We are on X, We aren't on TikTok because IU, at least at IU, I don't know about the other institutions, had put like a stop on accounts for universities for that, but we are going to in 2024 start using YouTube more and doing YouTube shorts. Additionally, we're starting to kind of encourage researchers to create short little videos about their studies to kind of help kind of explain it, what they're doing, and you're gonna see a lot more of that. So if you do research where you are actually trying to research with the public, or you have results that would be good for the public, we're going to work with you and kind of create these little shorts that we can kind of put out to the public. We have a newsletter. We have a community advisory board, which is primarily actually people within the community. A lot of times these are people that are in community organizations who kind of speak for the community, but we actually have community members on this. And as we are adding new members, as members are kind of rotating through, we're getting more and more people just out in the community and across the state. So we try to make sure we are representing people from a very diverse kind of group. So, you know, not just race and ethnicity, but also like rural, different parts of the state, you know, health conditions, things like that, that we can. So we have a newsletter. We have, like I said, social media. We have a website that I'll show you here in a little bit. And then for recruitment, for actual recruitment, so, you know, All In for Health is like an umbrella initiative. And then we have these other components to it, like a study listing, a volunteer network of this, basically a registry, and social media ads. And so Titus, you have your hand raised. Do you have a question?
Yes, as usual. So when you said there's a lot of engagement, across social media, you talked about it's not just pushing information out, but it's engagement. Like how do
What
you
does that mean?
quantify that? Yeah.
Yeah, so we have like, they have different kind of, so some of it is just like advertisements for studies that made, so that's more of that push out, like, hey, there's a study, and then we have them come to the All In for Health website to see that information on the study. And I'll show you kind of like an ad here that's similar to that. They have Feel Good Friday. So through Meta, like they'll put just something up there like, hey, today's a good day to exercise, and here's some stuff, or like, you know, here's a quote from somebody. And so they really try to engage people, not only just like we're pushing out stuff, but, you know, that people can respond to. And we do not block any comments. And even unless they're, you know, something that, you know, probably shouldn't be on there, but for the most part, that's really rare for us to do. Like we had one study that was looking at, you know, people having sensitivity to milk and lactose. And it was surprising to us that we had a lot of comments, like some negative comments about, as adults, you shouldn't drink milk and all this other kind of stuff. And we left those on there, and we just kind of responded and said, well, if you have any questions, you know, we'd be happy to talk with you about this or whatever, but we did not remove them. So we try to kind of keep the conversation going so that we, you know, shutting people down, I don't think is a great way for us to build trust. I think actually having that conversation where people can see that there's like different aspects of this. And so that's what we're trying to do. So I don't know, Titus, if that kind of helped or not. So
No, it did help. Thank you.
yeah. All right. So this basically all this map is kind of show you, it's not a surprise that you're going to see that most of the concentration is going to be around, you know, central Indiana. These are the number of people within our registry. We have almost at this point 15,000 people throughout the state. We have at least one person per county. So this is based on counties. And as you can see where the universities are, there's a lot more concentration. And I need to put, like, we just recently updated this. If I put this side by side with the next one, with the one from previously, I mean, you can really see that these groups were really trying to work hard to kind of get more people within those communities kind of registered on so that they can be available or notified of research. And this isn't the number of people that actually receive our newsletter. Our newsletter there's twice as many people who signed up for the newsletter, which, because we only collect from them, you know, like their email address and their first name, we don't really know where they're located. So hopefully we're tapping into more of those communities through the All In for Health newsletter, which goes out monthly. So Titus, here's an example of like an advertisement that we would do. So sometimes we have paid advertisements for studies that may be trying to reach a certain population. This is an example of one that people were really interested in. It was basically a nutrition study. It was done by IU Bloomington, and they were trying to get people to eat this avocado diet. The diet was provided for them, the food, and they had to have a certain cholesterol numbers to kind of be eligible. And so that's what made it a little harder to get people. And so we were utilizing this. And so, the goal, because you're using Facebook advertisements, you can't put all of your study information on there. I don't know if you guys are familiar with the study flyers where people will put everything on there and they'll have a tear off tab or whatever. That doesn't work real well anymore. And so these are basically, it's just give you a little bit of information. When you click here to learn more, it takes you to your All In for Health page, which I'll show what that is in a little bit. And so then they can be screened and find out more information about the study and be part of that. So and so this is what the All In for Health, the public sees. Basically it's a listing of your studies. When you're a researcher, you would actually log in. You can become a volunteer. You can be a volunteer and be a researcher. But if you do not have an All In for Health account, I encourage you to get one, to be a volunteer so you can be notified. But use, I would say use a different email, because we use your institutional email to create your researcher account. And you can't have both a volunteer account and a researcher account using the same email. So we would have to move you over. If you already have that, don't worry, the team can help you with that. But generally, it works better to have those two separated. And then you have ability to kind of search. You can search by location. So if you wanted to find studies that were only happening up in, let's say, West Lafayette, you could do that. And you can say like, how close would you want that to that? We also created these special categories related to studies where we see the most studies at. It's not necessarily obviously incorporate everything, but it's some of our higher volume studies. And then you can enter anything. You can enter investigator name, you can enter a certain condition. An interesting thing that we found out that I didn't realize is we were searching for something and we put baby in, and it came up all these studies, but it also found somebody on that study team that was named baby. And so, because I couldn't figure out why seniors, like the senior study kept showing up when I put baby in, and basically it searched for the study team too. So if somebody knows somebody's name and they're like, I'm just going to search for it based on that person's name, it actually will kind of search through that. So and this is the volunteer registry that people can sign up for. This is the registry is an IRB, so there's an actual consent to this. So the newsletter just collects your email address, and then you get a newsletter once a month, and it'll highlight some studies. But the registry will actually, investigators can send customized messages out to that person. Additionally, if you add certain conditions in there, it will find studies based on those conditions. So if you put diabetes and a diabetes study gets added, it'll say, hey, these studies are also looking for people who have diabetes. You might be interested in those. So that's within your portal that you sign up for. And then how a researcher uses this is like, so those people that are in the registry, you can kind of search. So this is actually what like a person's profile would look like once you created your volunteer profile. It'll say here's your age, your gender, here's your conditions, and hey, these look like you may be eligible for these studies. And then you can view details about the studies and send messages to them. And then when it comes through on the researcher end, it'll tell them, hey, there's actually a volunteer within there, and then you can respond directly to them. And so iConnect, you can promote your study, make it visible to the public so people can find it. If you search for clinical research There's different ways that if you put clinical research in there, like clinical research in Indiana or Indiana clinical research, we come up in like the top 2 or 3 for All In for Health. If you put study titles in there, we'll usually show up. So it's the Google algorithm. We've been working really hard to make sure that we are kind of high up in there, so it will help you kind of promote that. And the nice thing is, like, we'll create a basic study page for you, but as you can see, you can add a picture. There's a way for you to create a screener within that, so you can see whether people are eligible or not. So you only get those people that meet the criteria. You can we have one group who have some videos in there. The biobank actually has their video consent in there, just so people can listen to it ahead of time. So there's lots of things that you can do with your page. Additionally, you can create a study website within iConnect. And we have yet to have somebody take us up on that. And so we're looking for volunteers who are interested in testing that for us and kind of showing us what works and what doesn't work within it. This is just an example of when you do these pre-screeners, you would add these questions, you create it yourself. So similar to like REDCap, but I think actually simpler than REDCap. And you can kind of drag and drop things where you need to. And then you can see when you go in, if they aren't eligible, they aren't able to send you like that they're interested, but you can see that, oh, this many people completed the screener, and here's the people that completed it and are interested, and then you can see what their responses are. And then you can send these customized messages right through the system to them. And this is kind of just an example of what you can send your referrals, but these are campaigns. You could also track, like if I did a social media campaign, or I have 2 social media campaigns, I can actually track both those social media campaigns separately. And this kind of helps you, like you could even put like a budget in there. Like I'm gonna, do send something through the newspaper, and I'm gonna that's gonna cost me $1,500, and you can see how many people come through there, so you can see what's your return on investment. So that's available to you. I don't see a lot of people tracking this. I actually like this because I like doing this for tracking what we call A/B testing, which is we might have 2 social media ads and we want to see which one people respond to more. And then we can see which one, how much did we spend on that and how much did people come in. So you can do all kinds of customized reports. And, it's really in there to kind of help you kind of engage and keep all of your recruitment in one place. And like I said, and I should mention, this is totally free to investigators. Like there's no, other than like, if you wanted to do paid Facebook ads, there's a cost for that, but utilizing the system and the volunteer registry and all these kinds of things, and even the creating your website through this, all completely free. If you're at IU, your study automatically, well, I say automatically, we automatically add your study to this if you're recruiting human subjects. If you're at Purdue or Notre Dame or another institution that doesn't go through the IU IRB, then you just have to reach out to us and we'll help you get it on there. It's just because we don't have access to the IRB information to be able to add those directly. So if you're interested, you can go to this page here to kind of sign up for some training, learn more about All In for Health, and we can kind of help you work and utilize that tool a lot better. So before I move on to all of us, does anybody have any questions? Nope. Okay. You'll get a copy of the slides after this, so feel free to kind of ask. Oh, yeah, Jeff.
Yeah, I just wondered about do you know of the 15,000 people in the registry? Like, what's the breakdown for underrepresented minorities or people of low socioeconomic status? Like, do you do things to reach out to those specifically?
Yeah, I took that slide out. It's sad. Trying to think what the breakdown is. It's actually, think about, with the exception of Hispanic Latinos, we are slightly above what the state average is for those. So I want to say we're roughly about 10% African Americans. We're about 4% Hispanics. We're at like 5% Asian Americans. And then we have about like, I think 4 to 5% like mixed race. What we don't capture in this, which we're talking about like adding, but as you probably understand, it's a little hard to track over time because it's variable, but is socioeconomic status. So we don't get information on, you know, where they are. Now, what we can do is we have matched this to the Regenstrafe electronic medical record system. We don't pull data in from that into the registry because we haven't set it up for that, and we don't want to keep any health information in there. Well, other than self-report. So they put their self-report health information in, but we don't pull from actually the medical record system into that. But we can like use that. So what we have done is like, and a good example was the avocado study where we said, here's a list of the people that are in the registry. They're matched within Regenstrafe. So they have basically a matching, they're matched within there. And we found basically we have like, I believe it's 80 or 85% match to some health record. And so you can then say, okay, we want to see how many volunteers meet these criteria. And so one of them could be like, you could probably use insurance as maybe your socioeconomic. It's not a great substitute. I know that there's work on, you know, trying to get some of that social economic data, you know, like registry. And so if that starts kind of building, maybe there's a ability to match to that. But I don't know, Jeff, if that helped answer some of that,
Well,
you know.
I mean, I think there's some really superficial tools that use like zip code and things like that.
Yeah, yeah. We
And
have
I,
zip
I
code.
assume you have that
Yes.
kind of information.
Yeah, so
Okay.
we have zip code, and for one study that we were doing, this was during COVID, we had an investigator that was looking for people that were at high risk for COVID, but so they were living in certain neighborhood areas in Marion County, and then met certain criteria. And so we were able to, we took zip code. We worked with the Polis Center. They gave us like, we want so many people from this area, and they gave that to us. And we use zip code as our way of targeting those folks. And then the race ethnicity data that was in there. So we kind of use that. And a lot of times what we'll do is we'll recommend to people is that you kind of can prioritize who you're sending your messages out to first. So that like if you only have so many spots and you want to make sure that you're given opportunity to people maybe who don't normally participate, then you can kind of do that through there. Additionally, you can do that. You can't target through social media, like by race or disease category. Meta won't allow you to do that anymore. It's like, so you can't put certain things in your messages or things, but we have worked on ways to kind of help encourage you know, particular groups or areas where people are interested in it, and to do that. And we have a whole team that kind of provides guidance on how to help you with that. So, but we usually can work with you anyway. Like, so something, and what you might be that something you're doing, we're like, yeah, that might work best in here, or it won't. And we'll tell you, and we'll be like, we should go and do this. This might be a better way to do this. So.
Okay, thank you very much.
You're welcome. And just so you guys are the recruitment concierge service, we actually do complimentary consultation. So if you're like either looking to submit a grant, or you have a grant and you want to kind of look at your recruitment strategy or find which things kind of resources would work best, or ways to talk to certain groups, feel free to reach out to us and we'll set up a meeting. And I usually bring a bunch of different people in it based on your protocol. So if you say, hey, we're looking for a certain group, I might, you know, if pediatrics is, I think, an easy example, I'll bring Lucy Miller, I'll bring somebody from the Presnet, I'll bring somebody from these other groups who make sure we have lots of representation, and then they'll provide guidance like, oh, when you're talking to this group, you got to think about this and stuff like that. So it's a nice like one-stop shop for you to kind of think of it like the PDT. It's like a recruitment PDT. But we can throw like, I usually bring like Lori Trevino from the CRC if it's needed, or Chris Caldwell from regulatory. So you can bring all those people in together. So that's a great question, Jeff. Thanks for asking that. Any other questions? All right, we will go on. If you think of something while you're going, you know, as we're going through, feel free to bring it back. You can always email us at inhealth@iu.edu. Or you can email me directly, either way. But if you do in health, you'll probably get a faster response because depending on the day, as I'm sure you guys all know. Okay, so one thing to kind of know, because it's all in for health and all of us, and it gets confusing, and sometimes even I'll like say the wrong thing. Think of because it's all in, so in is for Indiana, you know, we're so in is for Indiana and us is for US. So think all of us is national and all in is local. But if you reach out to me, I'll help you figure out which one you need to go to if it gets a little confusing. So what is all of us? And so basically all of us was kind of created at the end of President Obama's second term in office. The idea was to get 1 million people throughout the US, primarily underrepresented groups in research. And so they were particularly going to target and wanted to get at least 50% of the participants in this to be of these diverse groups. And so they actually looked for recruitment locations in areas of populations that they wanted to be representative. So, and the goal was to get them to sign up to be part of this. It's not really a registry in that it's like other studies kind of go out to them, but it's really, this is the study. And so they answer questions about their health. They have their, the goal is to have them provide a genetic specimen. It's primarily saliva. If they can get blood, it's great. It just depends on where they're at. And match it to their medical record. And you'll see that based on the numbers that there's not everybody that's currently enrolled in there has every piece of that information in there. And so you can actually piece through when you're running your data and depending on what you want to look at to kind of help that. So this data that's in here, it's been updated since then. I think they're up to, I don't know, that Senate might probably know. It's like, I think it's like 600, over 600,000 or something like that. I mean, they're still recruiting, but some of the other data's, you know, a little bit lacking in there. So as you can see right now, they have 75% of the communities are underrepresented in biomedical research, and 45% are from racial and ethnic minority groups. Basically how it works is that participants kind of, you know, they sign a consent. Data is collected from them. Some places have mobile units. Some places are done directly in clinician offices. That data is kind of put through this kind of pipeline and goes into this hub of data. And then there's actually a cool thing that you can do. You don't even actually have to have a hub account to actually kind of do little how many people are in there. If you want to see how many people are diabetes, you can actually do this from the website, just kind of checking. You can't really get, I would say, you get more, it's just numbers. So I don't know, that sounded like a better way to kind of put that, but it's just like, so for you get an idea of what's in there, you can't really do any like data analysis on any of that. But if you wanted to get into and actually look at the data and actually pull data and kind of run, you know, some reports and do things, then you have to become a registered user, a research user. All of both Notre Dame, I say both, all three, Notre Dame, Purdue, and IU all have data use agreements to utilize all of us data. I think Purdue's a little bit different on how to get to utilize. I think I'll show you the different tiers of data. But for the most part, because you have a Purdue, an IU, or a Notre Dame email, you can automatically create an account and somebody doesn't have to approve it from your institutional side because the DUA is already signed. And then so as a registered user, you have to go through some training. And then once you get that training done, then you can create your own workbenches and things of that nature. This just kind of shows you what kind of spread where a lot of the participants are coming from. Indiana actually applied to be a recruitment site of participants. We didn't get it when we had submitted because I'm sure I'm preaching to the choir. We were too close to Chicago, and Chicago had a big kind of recruitment kind of going there. So While there's not a lot of people from Indiana necessarily in there, there is some, and they're primarily up here in this Gary area, I would imagine. But there is a lot of people from Chicago, obviously a lot of people from California. And so, you know, just kind of things to think about. And then to kind of go back to like what kind of information's in there about that, you can see only about half of them are white, and then you have this other kind of groups. We have about almost 18% Black African American, about 16% Hispanic Latino, and then here's your age breakdown. So as you can see, they're kind of curving towards the older, you know, which is probably not surprising. So here's like just a breakdown of the numbers. You have about 400,000 plus survey responses. We have physical measurements, genotyping. They just added Fitbit data, I want to say, in the last year or so. So those they're collecting that for some folks that are willing to share that. They're have whole genome sequencing. About half of the people, about a little more than half, they have matched to electronic health records. And when I say match to health records, you know, how much information is in that health record may be variable across the systems. And then there's a bunch of sequences and variants information in there as well. And I see there's a bunch of questions. So if you have a question, and maybe Nitsenna's putting that in. Okay, cool. If you have any questions or anything, feel free to just unmute and ask, put your hand up, and I will be happy, or Nitsenna will be happy to kind of help answer those questions. All right, let's see, next slide. All right, here we go. Just to talk about genomics, in case you were interested, this is a breakdown of the genomics information in here, and how you kind of match to these different data. This is kind of the numbers. So as some of the things that are newer, and they're always adding questions. So if there's a newer question, it may take a while for that information to get in there. Yeah, Kate.
Hi, sorry if I missed this. I joined a little late, but is all of this data human, or are there also animal models such as mice or rats?
Great question. All human, sorry. This is all human subjects research. So
Thank you.
yeah, no problem. So if you're doing animal research or animal models that you're looking at or want to see, you know, how does this look in maybe some of the other things were captured, then you can utilize it to kind of compare or maybe help with any of your mouse modeling or things of that nature. So this is just kind of the different things that you'll see within the data. So for the EHR, you're going to get your conditions, your lab measurements, drugs, procedures, observations, device. And sometimes they'll have it in the surveys too, and then it'll be in the EHR. So you just have to kind of check which place you're checking for it. And sometimes it may be a little inconsistent. Anybody who's worked with electronic medical record data, and I know Titus probably could attest to this, self-report, and sometimes the data I'm just thinking of like height and weight, you know, sometimes that doesn't get updated in the system as often, and then people that are reporting it might might over-report their height and under-report their weight. So, you know, just those types of things that you're probably already used to in working with people in general, you might have in here as well. So then you have your wearables, those measurement data. Here's their physical measurement stuff. And then additionally, you know, genomics. This is the type of information they're providing for genomics. When I was talking about what are kind of the data access to the public tier is the one I was talking about, where you can just go and, you know, feel free to test it out today. Go to all of us under the researchers, and you can kind of look at the data and just kind of browse around. It's kind of fun to do it a little bit to kind of see, oh, how many people are in there that have this or to have that, and you can kind of combine questions. But if you really want to kind of get in and start using the data, you need to register your account, register yourself. And for students can do this as well. So this isn't just for faculty. If you have students or grad students or people working with you and they want to kind of work with this data as a project, they would have the ability to access that. And then for folks that maybe aren't citizens, we have a workaround to kind of help people get access to that data. because they might not have like a state ID or something like that that would be required to register them. And then they would just work with us and we would kind of make sure that we helped you to get access to that. So something to know. And then this is the one that were Purdue's a little different for the controlled tier. Purdue, at least previously, wanted some additional information before they would forward people on. And so the Purdue gets up to the registered tier, and then I think they have to work with the sponsored programs office to kind of get to the control tier. For Notre Dame and IU, there isn't any barrier or anything that kind of alters that access to that tier. And then one thing to kind of know, you can't download the data. And so all the data has to be worked within the system. And so the types of analytic tools that are in there, you have notebooks and you have these workspaces that you'll kind of build. You have to know Python or R. Those are the two. I think they're working on having other analysis tools, but right now those are the two that you have to utilize when kind of analyzing the data. But our team can help you with that. So we're actually supported. We have some funding from NIH to support researchers at the 3 institutions to kind of be able to work with this data. So if you need help, we're here to kind of help you out. And then this is just basically some pictures of what the workspaces look like. You can create as many as you want, and then you can kind of utilize them and work through them. You can give other people access to your workbenches so you can work together collaboratively. There's other kind of features within there. And there's actually training. The training that they provide is actually pretty good. There's a lot of good videos on YouTube from NIH to kind of utilize this data, but our team is here to kind of help you too. And then, because you're just using data, you don't need an IRB approval. All of us already has an IRB approval for it to be a project. So it's like larger, but you as an investigator are just looking at data and it's de-identified data. So you don't have to have an IRB protocol to kind of utilize this data. Already talked about like accessing use through their DURA, which is their data use agreement. And then the other thing to kind of know is that they're very transparent. The goal that they spent a lot of work on was engaging the public as well. So just like all in, where we want to be transparent with the public and the community have an ability to kind of say whether they like the work that's being done or, want to be part of the work that's being done and things like that. So when you create your workspace the first time or any of your other ones, they will ask for a description of what you are doing, like what you want to look at or what your work is going to be on. So you'll want to think about that when you go to create your space. What is it that you're looking to do? And then if you're going to publish or do any, or even a poster or whatever, there's actually a form that you have to submit to get that approved. So there's like lots of things that kind of happen. Makes it sound like it's a little harder to use, but it really isn't. They try to make it as easy for you to work through as possible. So the data use team through the Indiana CTSI, we can help you register for a workbench account if you're struggling with that, set up your workspace. How do you look at the variables? How do you filter data? How do you do statistics within there? We can kind of help you with all of that. And we have so Nitsenet and Colin are like my 2 main people through biostats. And then we also have somebody through Cosley Simon's group down in Bloomington. His name is Hailey Michael. He's really good as well. He's in their data science group. And so any of our team can help you with that. And if you wanted help or wanted more information on it, here's the QR code to get to that. And have, we have a red cap link and you can just say what things you would like assistance for. And so just to kind of show you what the steps are, they have in here, like check for your institution's agreement. Just like I said, unless you're not at one of those 3 institutions that I just mentioned, then you should be good. If it's a Regenstrief account, that would be interesting if we would have to do an affiliate or if they count under IU. I'm not sure about that. If there's anybody here that has a Regenstrief email, but you'll have to verify your identity. And this is where I was saying that people that are foreign, either students or aren't citizens yet, there's ways that we can kind of help you do that, but you'll have to provide, like, if you're already a faculty and you have an ER Commons account, that makes it much easier. But if not, you just would use your driver's license or your state ID to help with that. And then, they'll have like training within there. The training, they say it takes a couple hours. Our team, who are like data people, were like, it took about 6 hours. They were really kind of honed in to kind of doing it, but you can piece it out. You don't have to do it all at one time. And then, you're kind of part of that. And here's the linkage to create a registered account. This one kind of goes straight through. We have, there's a main NIH one, and then this one is through the consortium that we're supported through. If you can use this one, it would be great, because then it will kind of help us track you through that mechanism. Although I get a report on everybody who's registered through IU, and then Notre Dame shares theirs with me, and I'm working on getting Purdue. So that way we can reach out to investigators and say, hey, how can we help you more? What kinds of things do you need help with? And then they have this researcher roundup newsletter, which is great. I find it very interesting. It tells you what they're doing. They're very forthright in like what their goals are. So I'm pretty sure soon the newsletter will say, here's what our 2024 goals are. The other thing I should mention is that these are primarily adults. Last year, I think their goal was to start enrolling in children. They haven't really done a whole lot, or I don't know how many children are in there yet. So if you do primarily children's research, or looking at rare diseases that are primarily in children or things like that, those will not necessarily be in there yet. So just wanted to make that clear. But yeah, this newsletter is great. And so if you're interested, and maybe you're not creating an account yet, but you'd be interested in hearing what's kind of happening, sign up for it. I always find that it's pretty engaging. So. And I think that's the last slide. What kind of questions do you have on that?
Yeah, I probably should have known this, but for all of us, is that a registry where you can reach out and contact people, or is it only just data?
Just data. Yeah. It's not set up for reaching out to people. If there is stuff that you're interested in that's more of a national level, there's Research Match, which is kind of like an all-in for health, but in national, we have access to that as well as a CTSI. And you can actually use both of those together. So you can use all-in for local, because we probably have more Indiana people in it. But if you're looking for national people, you can use Research Match for the registry. So
does Research Match, do they have the genetics?
No. Now, what they're doing for, I think eventually they may get to, for all of us, where, there's additional studies that are kind of on that. They are not there yet though. So, but, and you're familiar, Jeff, you work with the biobank, so all the stuff that goes on through there. But, there might be other things we can do for you for those projects between All In and the biobank. So if we needed to.
Yeah, I was just wondering about, like, when you want to study like a rare variant or something, and do some kind of deeper phenotyping.
Yeah.
You would really want to go on a national level. That's all I was thinking about. And most of the stuff is just in Indiana.
Yeah. Yeah. We could talk with Research Match, or just so you guys know, all of the CTSAs participate in this thing. It's called the Trial Innovation Network. And so there's ability that if you were interested in particular projects and you want to kind of work with other institutions, that they will meet and kind of talk about how can they, even if you're like submitting something for funding or thinking about submitting something for funding, it's basically a way for you to put your study out there. You meet with that team, and then they'll send something out to all the CTSAs and say, hey, we have an interest in this area as well. And so you can create these partnerships and work across the institutions. And so if that's something, Jeff, that would be of interest, Lori Trevino and I can help you with that.
All right, thank you very much.
Yeah, absolutely. Any other questions?
So there's one in the chat.
Okay.
How could All In work or help with recruiting Indiana youth?
Yeah, so it's Indiana Youth is kind of interesting depending on what you're looking to do there. Is that so you can register your child or dependent within there, but what we find is a lot of people will create accounts for themselves. They'll create accounts for their children if there are have a particular disease or condition that they're kind of come across All In for Health for. But a lot of times we'll use the newsletter and social media. So for example, we had a study that was looking for kids with sleep disorders, and so we use social media to do that and got inundated. And so it goes out to the parents, but really the youth were coming in. Now if you're looking for youth in general, like not necessarily through the parents, and you're trying to get the youth engaged, so maybe there's some project, like if we're thinking like something that maybe they're not likely to talk with their parents about, and so you're trying to gauge who's interested in and things like that, then we can kind of work with you. The recruitment concierge service would work with you and say, here's some other ways that are a good way to connect. Meta is not a good for that age group, so it's more like for the parents of that age group, and we're finding that there's more seniors using it too. So before I would have said, oh, it's not great for seniors, but since COVID, seniors have like blown up in using Meta, so it's a great place to kind of get seniors engaged in particular projects. But so for youth, sometimes we'll hit like what community members can we target. We're hoping in 2024 with us using the YouTube shorts, that will kind of assist with that as well. So hopefully that will kind of help tap into some of those groups that you're looking for. But if there's any like specific groups, feel free to reach out to me, and I'd be happy to kind of sit down and go, oh, here's some places that we can kind of tap into. So great question. Any other questions? Well, feel free. Jill has my information, or you can find me on the CTSI website. If you have any questions, you're welcome to reach out to me.